Our guest blends surgical excellence and visionary leadership in the field of ophthalmology. Dr. Basha is a fellowship-trained glaucoma surgeon and also specializes in cataract and refractive surgery. Dr. Basha, when he's not in the operating room or exam room, he is also the owner of the Fraser Eye Care Center. Welcome, Dr. Basha.
Thanks for having me.
You know, when you look at your career,
Yeah.
your training, your schooling
Yeah.
was medicine. You specialized in the eye, but now you're also a business owner, and those are two different animals. If you could go back and talk to your 18-year-old self, or maybe even a younger generation that maybe wants to do like a skill as well as create a business with it as well, what advice would you give?
It's hard to give, one piece of advice on how to succeed, I think, in business. At the end of the day, you are a culmination of what you did when you were younger. You can practice doing different things, but you develop hobbies and skills that you've accumulated over the years. So, for me, I had my first job when I was 10, and I was a newspaper delivery boy. I made I made $300 a month, and it was me and my two other brothers, and we all delivered the newspaper. And if we did not deliver the newspaper, my dad could not pay the mortgage. And then after that, I became a bookkeeper. And that really helped me be more focused on, company numbers. And then when I was 19, I bought my first house. And that was pretty eye-opening because I bought the house, and then after sinking a ton of money in it, I lost the house. I did. And then my first practice out of fellowship declared bankruptcy a year into my job. And so I think for me, those three things, being a bookkeeper at a young age, buying property and investing in property, really helped me be more disciplined in the future. And then seeing a practice falter really helped shape kind of my approach to how I should do things. You don't wake up one day and I'm going to do this. It's really a culmination of things that you've done over the years, and they feed off of each other. So if you have one trip up, like I had multiple, and it kind of shapes you where you feel like, well, I'm never going to do this again. It really will set you back. You really got to take it, grow from it, and then expand, because you really have no idea how these skill sets will intersect in the future. Mm. So I would tell a younger person, dabble in as many things as you can when you're young, because you have no idea what skill sets you'll develop in the future.
Buying a house at 19, that'd be tough for a 19-year-old to do right now.
Yeah,
the market's gotten crazy.
Yeah. And I was clearly not disciplined. I didn't understand what I was getting myself into. You turn on HGTV and you're like, I can do this. You can't. It's really not that easy. To do one is fine, but as you do more and more, you have to be disciplined.
Specifically owning Fraser Eye Care, what do you think is the most rewarding part of owning a practice? Without
question, the thing that is most rewarding for me is watching people develop. It's like having kids in a way. Seeing your kids do things that you're like, wow, it's pretty nice to see. Their first step, talking. And it's the same way with when you hire people in the organization. When you step back and you watch and you see personal development, whether they're physicians who are kind of developing on how to manage patients appropriately, whether it's surgically or medically, seeing, staff who become managers and leaders, I think by far is the most rewarding.
Now, one thing I did notice about you early on is you were big into networking. You really went out and you put your name and your face out there to almost everyone. Now, is that something that you just knew that you needed to do, or is that something that was, advice given to you?
It was advice from family members, at least early on, get out there and get to know people. And then really about 2-3 years after that, I stopped doing that as much, and I really became more focused. Networking is good, and so you'll see people who are in their 20s that focus on networking and will have a huge Rolodex of people they connect with. As you get older, your Rolodex gets much, much smaller. and you become more focused on who you can help and who can help you. And you kind of know exactly what you need. So over time, your networking kind of slows down because you know exactly what you need and you know what you're comfortable with. But early on, you don't know what you don't know. And the advice I would give young people again is don't say no to anything early on. Anything. Just go and try it. Mm-hmm. You know, somebody offers you anything, do it. And then over time, you'll learn like, hey, this is not for me. I don't feel comfortable doing this. I don't feel comfortable doing that. But whenever I see a young person from the get very rigid, like, no, this is not for me. No, I can't do this. It's a big red flag for me, because at that you should really kind of want to soak it in as much as possible.
Well, funny story about Dr. Basha. When he first started, he was really new. This actually still cracks me up to this day, but how you're saying you should try anything. We were networking, and there were these two guys that wanted to go golfing, and he's like, let's take these guys out golfing.
Yeah, I remember that.
And I'm like, well, I'm not that great of a golfer. And I'm like, do you golf? He's like, not really, no.
At that point, I have never golfed in my entire life.
Have you swung a golf club?
Never.
Oh.
So
I can give this a whirl.
I'm like, people play this game for 60 years plus of their life, and they still are not very good at it. He's like, I'll YouTube it. I'm a quick study.
He can learn anything.
What's wild is if he did do that, and actually he was like driving at 300 yards. I'm like,
Did you guys go?
No, actually, one of my mentors, Dr. Chakowski, the founder, he took me aside and he's like, I heard through the grapevine that you're taking some doctors out golfing. And I'm like, yeah, what's wrong with that? He's like, that's a horrible idea. You are not doing that.
You're like, okay.
That's a good conversation.
Noted.
But he did have a good point in a way. He's like, you want to be this elite surgeon. Yeah. You're showing them your surgical skills and how great you are.
Yeah.
You can't go out there and hit a golf ball to the women's tee. You got to carry yourself there as well.
Yeah, 100%. He was always concerned about kind of the image that you promote. And I just have a different approach, right? I like say yes to everything. Let's do this. I've never golfed. Let's try it. How bad can this really be?